I'm Dr. Wilshire. Today we're in the operating room, obviously, and we're going to be helping a lady who's having trouble with abnormal uterine bleeding. Now you figure, what's a fertility doctor working on abnormal bleeding for? Well, if the uterus isn't bleeding properly, it's probably not going to be as fertile as it should be. Now, in order to understand abnormal bleeding, you have to understand normal bleeding. Now, normally a uterus prepares itself for an embryo, and if an embryo does not come down the tubes, the lining sheds. The uterus contracts, it all happens at the same time. It's all coordinated, so the bleeding is self-limited and obviously not life-threatening. If there are abnormal hormones, then this isn't occurring properly. That used to be called dysfunctional uterine bleeding. Under the category of heavy bleeding, painful periods, crampy periods with abnormal ultrasound findings, this is generally called abnormal uterine bleeding. Now the lady we're going to help today, we're going to be able to approach these lesions or these abnormalities in her uterus with a telescope from below called a hysteroscopy. There's no cutting in the abdomen. Her recovery should be rapid and should be not very painful at all. Our goal today is to go up inside the uterus, remove the abnormalities we see on ultrasound, and this should hopefully help her bleeding, should improve her fertility, and it'll rule out the possibility that there may be cancer in what may be polyps or tumors in her uterus. So, even though this might not seem like a fertility treatment, it absolutely is. And even if a woman's not trying to get pregnant, if she's having abnormal bleeding that's affecting the quality of her life, clearly this is something that we can do for her and to her benefit. I hope this is helpful for you. And any questions you might have with regard to abnormal bleeding and hysteroscopy, thank you for your time. Once again, this is Dr. Wilshire at Missouri Fertility in Columbia, Missouri. Thank you very much.